Principles of epidemiology and epidemiological methods. Prin- epidemiological methods. CHN is based on comprehensive health and nursing care services to people at large to achieve the goal of health for all. Community health nurse to study the community, make systematic assessment and diagnosis of health status, health and nursing problems, plan and implement health and nursing care and evaluate care based in goals and objectives. Epidemiology is the study of various factors and conditions that determine the occurrence and distribution of health. Of health, disease, defect, disability, and death among group of individuals. Epidemiology is the study of distribution of a disease or a physiological condition in human population and of the factor that influence this distribution. The epidemiology is that branch of medical science which deals with epidemics. Basic tools of measurement in epidemiology. Measurement of occurrence of health related states, which include diseases, disabilities, their physiological condition, health needs, health demands, health behavior, and healthcare utilization. The measurement are done in the form of rates, ratios, proportion, example incidence and prevalences rates for various disease. Male family infant ratio. These rates and ratios can help in doing comparison of different communities from time to time. The study of determinants of health related states and events when can be done by testing of a etiological hypothesis. Etiological hypothesis. Derived from descriptive epidemiological studies. The hypotheses are tested by analytical and experimental epidemiology by using well designed studies. Planning of healthcare services based on the epidemiological studies, implementation and evaluation of healthcare services. Study of distribution of disease pattern, disabilities or death. It may occurrence is more in man than woman and in particular age, lifestyle, socioeconomic states. The basic methods or tools for measurement in epidemiology rate are rates, ratios and proportion. First we have rate. It measures the occurrence of some particular event in a population during a given period of time, birth, death, and diseases. Now, death rate is number of death in 1 year, mid-year population of same year into 1000. Ratio. Then next is ratio. It is measure of events which expresses a relation in size between two different factors. Example, the number of female girls in the ratio of number of male boys. Male boys is to female girls. Number of boys upon number of girls. Next is proportion. The proportion is a ratio which indicates the relation in magnitude of a part of the whole. A proportion is usually expressed in percentage. Number of, for example, number of children with malnutrition in community divided by number of total children at the same time in that community into 100. This is the proportion. Rate and ratios can help in making comparisons of one community with the other community, decreases morbidity and mortality, and accordingly one can evaluate the effectiveness of healthcare services. Now we have uses of epidemiology. Identify the determinants of diseases, diagnose the health status of community by identifying the health problems, identify syndromes by describing the distribution and association of the clinical phenomena in the population, study the occurrence and distribution of diseases in the community, estimate the risk, that is accident and defect, disabilities and chances of avoiding them, determine the useful and effectiveness of new measures and programs, etc. before these are used widely. Example, pulse polio vaccination. Determine the usefulness and effectiveness of healthcare services planned and implemented on the basis of predetermined criteria regarding its effectiveness, efficiency, and impact on community health. Forecast the likely occurrence of certain diseases on the basis of epidemiological principles. Logical principles, not princes. Okay. Next is disease cycle. Has six stages. First is incubation period. In this stage, the interval between the entry of the disease agent in the body and the manifestation of clinical signs and symptoms. Then we have prodromal stage. In this stage, 1 to 4 days and is marked by vague sign and symptoms, but clinical diagnosis is not possible. Third is fastigium stage. In this stage represents the height of the disease, signs and symptoms are clear cut and diagnosis is possible. Then we have defervescence. In this stage, the person client feel better, the body defenses begin to respond. Then we have convalescence. In this stage, client patient recovery is establishment, he she is improving fast. Then we have defection. In this stage, patient client recovers from illness, he she can free from diseases and able to do work. Next is spectrum of disease. Spectrum of diseases is a graphically representation of variation in the clinical manifestation of disease. It is like rainbow to the spectrum of light where the colors vary from one end to the other but difficult to determine where one color ends and other begins. At end of the disease spectrum are subclinical infections which are not ordinarily identified and the other end are fatal illnesses. Middle of the spectrum lies illnesses ranging in severity from middle to severe. These different manifestations are simply reflections of individuals' different states of immunity and receptivity. Spectrum of diseases can be interrupted by early diagnosis and treatment or by preventive measures, which, if introduced at a particular point, will prevent or retard the further development of the disease. The concept of spectrum of disease provides for the inclusion of all cases, both subclinical and clinical, in the study of the disease. Then we have level of prevention of disease. Primary prevention. It is defined as the action taken prior to the onset of disease which removes the possibility that a disease will ever occur. It's called primary prevention. Okay. It consists of general health promotion, then specific protection. Community health nurse can prevent a number of diseases such as typhoid fever, TB, HIV, hepatitis, cholera, and nutritional diseases by promoting the health of the individual and community. They include adequate nutrition, provision of safe water supply facilities for the safe of human excreta and human waste, personal hygiene, physical education, periodic health screening, and improving the quality of life of the people. Then we have specific protection. Specific protection help to preventing specific diseases by specific measure. Example, diphtheria, tetanus, polio, measles by immunization. It is a desirable goal. It recalled the fact that the developed countries succeeded in eliminating most of the infectious diseases by primary prevention. Next is secondary prevention. It is defined as the action which halts the progress of a disease and its incident incipient stage. At its incipient stage. And prevents complication. The specific implementation are early diagnosis, adequate treatment. Early diagnosis consists of screening tests, care finding programs. Adequate treatment is we do not have vaccines to prevent all disease for diseases of this category. Example, malaria, syphilis. Early diagnosis and treatment is the only solution. Earlier a disease is diagnosed, the better. It is from the point of view of the preventing the occurrence of further cases in the community. It is like putting out the spark of the fire rather than allowing it spread and call the fire brigade later. Then we have tertiary prevention. Tertiary prevention is defined as the all measures available to reduce or limit impairment and disabilities, minimize suffering caused by existing departures from good health, and to promote the patient's adjustment to irremediable condition. Implementation are disability limitation, rehabilitation. Disability limitation and rehabilitation. Disability is tertiary prevention attempts to prevent disability through rehabilitative strategies. Rehabilitative strategies are used to attain the highest possible level of functional ability. It involves coordinated efforts of medical personnel, doctor, nurses, sociologists, psychologists for training and retraining of and helping the person to function well and restore a feeling of well-being. Then we have rehabilitation is with regard to restore of the personality, confidence, physical functions, family and social relationships. Oh, sorry. Capacity to earn livelihood. And we have disease transmission, direct and indirect. Disease. Spread may be direct or indirect sources or reservoir of the infection to a susceptible human host. Diseases are able to plan suitable preventive and control measures. It is of two types of sources: source of infection and modes of transmission. Source of infection in most cases is man himself who has the disease, and he may be a case or carrier. It may also infected by animal, example dog. Then we have mode of transmission. Modes of transmission may be classified into two categories: direct or indirect. Direct contact, droplet infection, contact with infected soil, transplacental inoculation into skin. Diseases are transmitted from person to person by direct contact, example sexual contact, kissing, phylus, gonorrhea, scabies, skin sepsis. Droplet infection like cough, sneezes, even talks loudly. Fine droplets of saliva containing bacteria and virus are blown into the surrounding air. These droplets become sources of infection when inhaled by susceptible persons. Diseases transmitted by droplet infection include common cold, measles, whooping cough, cerebrospinal meningitis. Contact with infected soil. Some diseases agent may be acquired by direct contact with the infected soil. Example hookworm. Transplacental transmission. The disease transmitted in utero from mother to the fetus. Example AIDS, hepatitis B. Inoculation into skin or mucosa. Diseases agent may be inoculated directly into the skin or mucosa. Example dog bite, hepatitis B. Indirect transmission is airborne, fomite-borne, vector-borne, vehicle-borne. Airborne transmission includes but droplet nuclei and infected dust. Droplet nuclei, there are very small infective particles which keep floating in the air. They are generated during sneezing or coughing, example TB, measles, influenza. Infected dust, larger droplets which are expelled during coughing, sneezing, settle on the floor, clothes, linen, and become part of the dust. Fomite-borne are the articles that spread infection to other because they have been contaminated by pathogenic organisms. Example, drinking some glasses, door handles, towel, toys. Vector-borne transmission, disease spread by vectors. Example, mosquito, rat, malaria, filaria, kala azar. Vehicle-borne diseases spread by vectors. Why vehicle example? Water, milk, or food. Diseases are waterborne diseases, milk-borne, foodborne, hepatitis, diarrhea. Next is immunity. Immunity is the power of the body to fight against infection. Factors affecting immunity: age, sex, general health, fever, inflammation, nutritional factor, mechanical barriers, hormonal influences. Yeah, sorry. Next is classification of immunity. Natural, acquired, Natural is subdivided into three: species immunity, racial immunity, individual immunity. Racial and then the individual. Species immunity is a total resistance shown by all members of particular species. This is due to physical and biochemical differences. Example: dog, sheep, horses, guinea pigs. Racial immunity within a species, there may be marked racial differences in resistance to infection. Example: Algerian sheep is resistant to anthrax as compared to the European sheep. Algerian sheep is resistant to anthrax. Individual immunity: different individuals in the rare differ in their resistance to infection. Example: in a large number of people are exposed to particular infection. Acquired immunity is divided into active and then the passive. Active is into natural active immunity and the artificial. Passive is also natural and artificial. Acquired involves the active involvement of person's own immune system. It is induced by injection. It further divided into two. Natural active results either from subclinical, long-lasting immunity, diphtheria, whooping, measles, mumps, short-term immunity, common cold, influenza. Artificial active immunity, bacterial vaccine, live BCG for TB. Live BCG for TB. Killed cholera, pertussis. Bacterial products: tetanus toxoid, diphtheria toxoid. Viral vaccines: oral polio vaccine, MMR, measles, mumps, rubella. Killed influenza and hepatitis. Passive immunity is transferred to a recipient in a ready-made form is called the passive. Natural passive is resistance transferred from mother to fetus through placenta. Artificial passive is transferred passively by administration of antibodies. Example: tetanus antitoxin, toxoin, or gas gangrene gangrene antitoxin. Immunizing agents and immunization schedule. Immunizing agents and schedule. The process of increasing the resistance of a person to a particular infection by artificial means is called the immunization. Its purpose is to provide protection before the child is exposed to infection, control the effect, control the infection in the community in addition to providing individual protection. Vaccine: it is a preparation of disease agent or its toxic product which when administered stimulates specific antibody formation. Common vaccines used in India: live attenuated vaccines, BCG, OPV, measles, mumps, BCG, OPV, measles, mumps, live attenuated, killed, typhoid, cholera, whooping cough. Plague, rabies, influenza. Toxoids, we have diphtheria and tetanus. Combined mixed vaccines. DPT, TT, thyroid, parathyroid, paratyphoid. It is typhoid. Then we have MMR. That was the stomach. Hazards of vaccination. Local sepsis, fever, malaise, convulsions, allergic reactions, serum hepatitis, soreness at infection sites. Then we have national immunization schedule. Here is we're gonna write. We're gonna now draw a chart like this. Age, all right. Vaccine, dose, route, and the disease prevention. Okay. At birth or 0 to 7 days, vaccine BCG and OPV, dose 0.5 ml, 2 drops, 11 oral for prevention of tuberculosis and polio. Okay, then we have at 6 weeks, 1.5 month, DPT 1, OPV 1, 0.5 ml, 2 drops, intermuscular orally for prevention of diphtheria, pertussis, tetanus, polio. It's called DPT. Then at 10 weeks, that is 2.5 month, DPT 2, OPV 2, 0.5 ml, 2 drops, intermuscular orally. Diphtheria, pertussis, tetanus, polio, same. Then at 14 weeks, 3.5 month, DPT 3 dose, OPV third dose, 0.5 ml, 2 drops, orally and orally, both are orally for the same prevention. Okay, then we have for 9 to 12 months, For measles, 0.5 ml intramuscular for measles. Then 16 to 24 months. DPT booster, OPV booster, 0.5 ml 2 drops IM orally, DPT and polio. Okay. Then at 5 to 6 years, DT, 0.5 ml intermuscular, diphtheria and tetanus, DT. Then at 10 years, TT, it is for tetanus, 0.5 ml IM, tetanus. Okay. And the next 16 years, TT, 0.5 ml intramuscular, tetanus. Then for pregnant 4-month lady, tetanus 1, 0.5 ml intramuscular. Of course, it is for the tetanus. Alright. And the 5 months pregnant lady, TT second dose 0.5 ml IM tetanus. Okay. So this was the immunization schedule. Okay. Look it like this. Or whatever. Vitamin A supplement 2 lakh units should be given from 6 months to 6 years at the interval of 6 months. Cold chain vaccine must be stored at proper temperature in order to be effective. The cold chain is a system of transporting and storing vaccines at the recommended temperature. Cold chain equipments, walk-in cold rooms, deep freezers and ice-lined refrigerators, small deep freezer, cold box, vaccine carrier, day carriers, ice packs. Recommended temperatures. Vaccines must be stored at 2 to 8 degrees Celsius temperature. Do not keep DPT, DTS, TT vaccines in the freezer. DPT, DTS and TT. No freezer. Okay. Control of infectious diseases. Controlling the source or reservoir of infection, blocking the channels of transmission, protecting the susceptible population. Controlling the source. Early diagnosis, notification, isolation, treatment, surveillance, disinfection. Early diagnosis means find early and accurate diagnosis of the cases and carrier. When the diagnosis is in doubt, first you should clear the doubt by laboratory methods. Notification done by the health worker within 24 hours of the occurrence of the case to primary health center. In urban areas, cases must be reported at the local health authority. Notification helps for further action to be taken to control the spread of action. Isolation. Patients suffering from infectious diseases should be isolated. The purpose of isolation is to limit the spread of disease in the community. The duration of isolation depends upon the particular disease. Treatment reduces the communicability of the diseases, cuts short the duration of illness, and prevents the development of secondary cases. Surveillance. This is a concept in disease control. It investigation of all cases to find out the sources of infection and institution of prompt control measures. Destruction of the infectious agent in the excretions of the patient and the articles contaminated by patient are important steps in the control of spread of infection. Blocking the channels of transmission. Disinfection of water supplies, control insects and rodents, safe disposal of human excreta and solid waste, improving the standards of the food hygiene, protecting the susceptible. Immunization helps to prevention of many infectious diseases, lies in the immunization before the onset of the disease. Immunization is an important weapon in the control of spread of infection. Health education, successful control of any disease requires community participation. It is through the health education we try to enlist public cooperation. Disinfection, sterilization, disinfestation, deodorant, detergent. Sterilization is a type of disinfection. Concurrent disinfection, terminal, prophylactic. Concurrent disinfection measures as soon as possible after the discharge of infectious material from the body of an infected person. Terminal disinfection measures after a patient has died or has been removed to a hospital. Prophylactic disinfection measures after boiling of water, pasteurization of milk, washing hands with soap and water are examples of the prophylactic disinfection.